So what is the difference between a person who can make a decision and doesn't make a decision? Let's talk about patients in general. Practices see lots of new patients. And doctors are always perplexed how when they bring a patient in and they do a workup with the patient and they show the patient that they have the solution to the patient's problems, and then the patient says, I have to think about it. Or the patient says, I'm not sure. Or I need to talk to somebody else. Or I need to read about this. I talk to doctors all the time and they're just so perplexed. They know that they can help them, but the person can't actually make the decision. Well, the most dangerous part about this is that they sit in this indecision and they sit in this kind of maybe, and all they do is they kind of drift around in their problem and they never get better. And many times in this state, they almost get worse. It would almost be better to say, no, I like my back pain. I decided I'm going to keep my back pain because they'll move on with their life and do something. Or to say, yes, I choose help. But making a decision or not making a decision is not unique to our patients. It's so unique to the number of doctors that we speak to. We speak to thousands upon thousands of doctors that want help. And it just so amazes me when we have these conversations. And at AMI, we've been doing this for 11 years. We've helped over 1,000 doctors grow their practices. But it still perplexes me when somebody says to me, I have to think about it. Call me in 3 months. I have to actually move my furniture around in my office. I've heard this. I have to move my office around first, and then I can think about it. And it totally perplexes me because I need to grow my practice. I need to do something more. But I can't decide, yes, I'm going to do something, or no, I like the situation I'm in. Instead, they drift. And what happens when your patient drifts is you find them 6 months or a year later in the same condition as they were, or worse. Their back is worse. It's the same thing when we circle back around to these doctors a year later, and they're still talking about that they should do something, and their practice is worse, or just they have the same problems that they had the year before that they wouldn't have to have. I go back to the patient. They don't have to have their back pain. It could be done by then. And just like practices, the practice is going to be grown by then. So I always found it so perplexing of the simplicity of saying yes or no. And it seems like, golly, that maybe sits in the middle, and that is just like the abyss. You just live in the abyss at that point. So my recommendation is make a decision. Even no is a decision.